Thanks to his humor and positive attitude, you'd never guess Jim Bach recently went through a battle with cancer. In March of 2023, Jim wasn't feeling quite himself.
I was just getting unusually tired, weak, mostly when doing more physical work. Then, I don't know, maybe a few weeks later, I had a nosebleed that wouldn't stop. So after about an hour, I went to the emergency room in Lamar's hospital, Vera Hospital there, and they finally got stopped. I actually had a blood test not related to this in Sioux Center Hospital at Avera, and the next day they called me and said it was unusually low for my white blood cell count. So then they wanted to come back again and do a teleconference.
A few days later, that's when he found out he had leukemia.
Eventually, we got to his diagnosis, which is acute promyelocytic leukemia. It's a relatively uncommon cancer here. So for reference, we have about 20,000 new cases per year of something called acute myeloid leukemia. Well, his disease, acute promyelocytic leukemia, represents 5% of all of those. We don't know entirely what causes it. We know it's associated with a mutation that interferes with the normal maturation process of a stem cell, from a stem cell to an immune cell. Well, this mutation disrupts that and produces an accumulation of cancer cells that can lead to some complications.
After talking with Dr. Andrade Gonzalez, they determined how they would fight his cancer.
That's one of the major breakthroughs in the treatment of this disease. So say 5-10 years ago, we would have treated with conventional chemotherapy. Now, these two drugs are not chemotherapy on their own. They're what we call differentiation agents. So they just target this mutation and kind of fix the problem.
As part of that treatment, Jim would need to stay in the hospital for 5 weeks. He was thankful for everyone's care at each level of the hospital.
I was very confident in Dr. Andrade. I knew he had the right treatment for me. Just there again, just can't say enough good about him, his staff, all from the kitchen people and the people I delivered, who pretty much knew what I wanted. It was usually biscuits and gravy, because I love their biscuits and gravy. And the people that would come in and clean my room, and I mean, just everybody.
He also credits his family's dedication and his sense of humor for helping him get through this tough time.
They were there for me the whole time. One of the hardest things I ever had to do was deliver the news of my diagnosis to them. It was devastating, but they were my biggest supporters. If you can have humor in your life, for me, that's the gift I have. I have a plaque at home that says, laugh at yourself, or a lifetime of free entertainment, and that was pretty much what I lived by.
After a few more months of treatment, Jim can now say he's in remission.
Oh, he's doing fantastic. He's doing great. We've gonna keep monitoring his disease even after treatment. Thankfully, every time we check, he continues to be in remission. All his blood counts have normalized.
I mean, look at me. I'm just a specimen here of health. No, I feel good.